Hi, my name's Cody Lynn Kaler, and I'm from Ohio, and I'm a diamond with Young Living. And I want to share with you today about my journey with chronic ovarian cysts and endometriosis. So when I was in high school, I was diagnosed with chronic ovarian cysts. It was kind of a process. Originally, they told me that I was just having mid-cycle pain called Mittelschmerz, and that it was just normal. And I had a lot of male doctors that just kind of wrote me off and thought that I couldn't handle the pain of having a cycle. And over time, it just continually got worse. And finally, I got to see a specialist and was diagnosed with endometriosis. So around the age 17, I had laparoscopic surgery and was told that I had severe endometriosis and there's a good chance I may not have kids of my own. That's a pretty scary diagnosis for a teenager. And I was really lost and confused as to what that meant for me and how this happened. I knew that my mom had had problems also and had an early hysterectomy, but I wasn't quite sure how it came about. Why me? And I had a lot of research to do, but I was very young, and so I didn't really understand a lot of that. At that time, the treatment for endometriosis and chronic ovarian cyst was to put a woman on birth control, and if one didn't work, then they would put you on another, and if that didn't work, they put you on another, and another, and another, until they found one that was sufficient, that would keep the pain and stuff away. What I didn't know back then was what was normal for a female cycle. And all of my years of growing up, nobody ever really mentioned what was normal. And so for me at that time, I thought really heavy cycles were normal. Lots of clotting was normal. I thought that really intense pain for a week at a time was normal. At one point, I thought bleeding for up to 6 weeks at a time was normal. It's not normal, not at all. And unfortunately, we don't talk about those things. We don't share with young women and young girls what it is to have a normal cycle. That a normal cycle is about 4 to 7 days long, and that it will vary from light to medium to sometimes heavy, but it really shouldn't be massively heavy. That it shouldn't really be extremely painful, and we just don't talk about that. So after I was diagnosed, I had a rough couple of years. I ended up having 5 laparoscopies and a DNC. Those are all surgeries where they go into your stomach and they blow you full of air, and they go to the outside of your uterus and they scrape off all the stuff that they find. So endometriosis is when the endometrial lining grows on the outside of the uterus as well, and also when you get adhesions, and they kind of remind me of like the cobwebs you would see in the movies, you know, like in the old creepy houses. When you see a picture of it, that's kind of what they look like. And they can attach from your uterus to all your different organs within your abdomen, and it can cause a lot of pain. And so they would go in on these surgeries and they would try to cut all that stuff out to keep it from causing more problems. So I was very young then. I got married young and knew that there's a good chance I may not have kids of my own. Well, when I was 22 years old, I was actually able to get pregnant and have a child of my own. And what I found was that while I was pregnant and breastfeeding, I had no problems at all. And I felt amazing. And I thought, well, that's crazy. Why do I feel so good when I'm pregnant and breastfeeding, and then all of a sudden, when I stopped breastfeeding, within a couple months, I was miserable again? And I did some research and found that it's because of progesterone. Progesterone makes you feel wonderful. It's the women's happy hormone, and we need a good amount of it to be healthy. And I found that when you don't have enough progesterone, you end up with problems like chronic ovarian cysts and endometriosis, that those are fed by estrogen, and it makes them continue to grow and to be worse. So it made sense when I had really high levels of progesterone that I felt amazing, and then when those levels dropped off, then I felt miserable again. So when I was 23, I was just had a new baby and was feeling awful again, and I was told that I had already worked my way through all of the different birth control options at the time to treat the endometriosis. And at that point, my only options were to have a hysterectomy, a complete hysterectomy, or to go on a medication called Depo-Lupron, which puts you into a chemical menopause. It is a chemotherapy drug that they use to induce menopause at an early age. Neither one of those sounded good to me. Neither one sounded like a viable option. And so I decided I would rather just stick it out and be in pain than have to worry about being in menopause at the age of 23. And so I opted not to have a hysterectomy. I opted not to take the medications, and I just opted to suffer. It's a good thing I did, because a couple years later, I was able to get pregnant with my youngest son, and that wouldn't have been possible had I just followed their routine method for treating me. And I felt really good with him. Same thing during pregnancy and breastfeeding. I felt wonderful, and then things fell apart again afterwards. And so I had this experience to know that progesterone is good, estrogen not so good, or too much estrogen is not so good, but I didn't really know what to do with it at the time. It wasn't until I started to really dive into natural health that I learned about the balance of hormones and natural hormones versus synthetic hormones, and that I really learned how to take care of myself and to advocate for myself. So with my experience, I went to my OBGYN at the time, and I had been seeing him for, 10 years. So we had a long relationship, and I told him I was concerned and I would like to have some blood work done. And he told me that I wasn't having any symptoms. I wasn't complaining of a lot of pain or crazy cycles, just the normal heavy cycles. And that he didn't think I needed to have the blood work done, so he wasn't going to authorize it. That was a wrong thing to say to this redhead. So I went around him and found a way to get the blood work ordered, and I did a consult with Dr. Dan Purser. He is fabulous. He knows hormones frontward and backward and all around. And he was able to look at my blood test results and tell me some pretty alarming things. I actually say that he saved my life. And I know that seems kind of crazy when we're just talking about hormones, but it's true, because the hormones affect so much of the bigger picture of how you're functioning that we don't really think about that. So what I found out is that my progesterone levels were at 0.3, and my estrogen levels were sky high. And then I had like 0 testosterone levels, and that my cortisol, or my stress hormone, was through the roof. And my C-reactive protein, or cardio-reactive protein, was 11. So let me tell you, your C-reactive protein should be 3 or less, okay? And your cortisol level should be way less than mine was. It shouldn't be through the roof. And when those two are high at the same time, it really drastically increases your risk for having a heart attack or stroke. I didn't know that at the time. And I found out for women, that's often why heart disease is silent, because they don't know that it's happening. They don't really understand that these kind of levels are off, and it puts them at risk, and then bad things happen, and they had no idea it was coming. So that really shocked me. And so I went right back to my OBGYN and said, here, look at these results. And he said, this is terrible. You need to reduce all your stress right now, or you're going to have a heart attack or stroke. Like, thanks. Remember I asked you for these blood work and you told me no? And he didn't really have a solution for me other than just reduce your stress. That was his way to solve it. And that didn't really work for me. At the time, I had an immune-compromised child. And there was no way, an easy way to reduce stress. It just wasn't possible. And so I knew that there had to be a better way. And so I followed Dr. Dan Purser's recommendations, and I found a new doctor who understood natural hormones a bit better. And I started researching like crazy. And I found that never in history has there been a report of natural hormones causing any type of adverse reaction or cancer. Yet in synthetic hormones, it is known that they do cause cancer. And that it's not a matter of if you get it, but when you get it. And I had already been on birth control pills for ages. And so it ended up being like 15 years. And I used to know a statistic. There was one that for every pill that you take, it takes so much off of your life because of the risk that has. I don't remember what that is right now. But I started to find all of this research on my own. I started to learn that I could make better choices for myself with the information that I had. I learned to advocate for myself. And so I started using natural hormones to adjust my levels. And what I found was when I supplemented with natural progesterone, my levels would come up and my estrogen levels would come down and I would feel amazing. Not just amazing, but like a new person. Did you know things like fibrocystic breast tissue, migraines, night sweats, let's see what else, anxiety, panic attacks, heart palpitations, all of those things can be connected to progesterone levels that are too low? Shocking, isn't it? There's so much that's connected to low progesterone levels that we don't even think about. Most people just think of it as the hormone that you have when you're pregnant. They don't think of it as a hormone that you need every single day. And so I started making some natural changes and I started to notice a huge difference in how I felt. I was a new woman. I felt amazing, like I hadn't felt in 15 years. Then I started to look at my lifestyle and I learned, you know what? When we use synthetic chemicals, they are very similar in structure to estrogens, and we call them xenoestrogens because when they go into your body through your pores, they get down onto your cells and they start to clog up the receptor sites. So I always tell people your cell is like a ball, okay? Imagine it like that. And there's receptor sites all around the outside edge of it. And these xenoestrogens, or these bad guys, go and clog up those spots. So when a real estrogen comes along, your body doesn't recognize it because that spot is already full, and so your body starts to pump out more estrogen, and so you get more and more estrogen in your system, and it becomes this crazy nightmare of too much estrogen happening, not enough progesterone to balance it. So I ditched all the chemicals, and I know that seems kind of scary, kind of drastic, but it was so worth it. We don't use any chemicals in our home now. And it's not just because, oh, they smell bad, they can do bad things to you. It's because it's really a matter of life or death. I know it's so drastic. But when you think of it as, if I'm going to continue to use this chemical, I'm going to continue to have these health issues. And those health issues put me at risk for a heart attack or stroke. So it became a no-brainer, right? You make the better choice. So my mantra is no more, do better. So I researched and learned and I knew more, so I had to make a better choice. And so that choice included ditching all of the toxins, ditching all of the chemicals, anything that was going to increase my estrogen levels. It also meant increasing my progesterone levels naturally. When I did that, huge benefits. I felt wonderful, and I have since then. So when I got that blood work done initially, I was diagnosed with primary ovarian insufficiency. What no one had told me in all of these years of visiting doctors and having surgeries and taking birth control pills was that when you take birth control pills, the long-term risk is that they shut down your ovaries and that they no longer work. Not a single doctor in all of those 15 years told me that. They might have assumed that I knew. They might have maybe thought that I read the fine print on all the little paperwork they handed me. But I had no idea that I was risking my overall health and function of my body parts by taking this pill that they said was going to fix me. Had I known, I would have made a better choice. I just didn't know. But we do the best we can with the knowledge we have at the time. So I started taking this natural stuff and kind of waited to see what happened. And guess what? Parts started working again. Isn't that amazing? Started working the way they were supposed to. So when you support your body with natural things, your body begins to do what it's supposed to do. It functions the way it's supposed to function. It's pretty awesome. And so now, at 35, I can say that I have completely overcome endometriosis and chronic ovarian cysts. I haven't had any issues for over 5 years. I function normally, what is the true normal, and I don't have any problems. And now I have the privilege of educating other people on natural health and how natural hormones can really benefit your body. So, if you're facing a diagnosis like chronic ovarian cyst or endometriosis, what do, right? Where do you go from here? The first thing to do is to go to your doctor and have a very honest conversation with them. Find out where they are and what their belief is when it comes to natural hormones. I had one doctor who said he understood natural hormones, so I said, okay, you can be my doctor. And then I found out that he wanted me to come back to his office every 3 months for breast exams. That's crazy. There's nothing to justify it. When I questioned him, he said, well, it can cause cancer if you're being on a high dose of progesterone, and so we have to check to make sure every 3 months. So I was being charged a lot to come into his office every 3 months. I mean, this sounds crass, but to be felt up. That was it. And there was no scientific backing for that. So I came into his office one day for one of those lovely exams, and I left him a stack of papers this thick of all the studies that I had showing that progesterone has never once in history caused cancer. And I left it on his desk, and then I never went back because he really isn't informed when it comes to natural hormones. And so I found a doctor that was good, that could help me. So you want to go find a doctor, have a good conversation, see where they are. See if they're going to be willing to work with you. Having a good doctor is like sitting down and having a meeting of the minds. It is a two-way conversation. It's not just, this is what you do, you listen or you're not my patient. It's oh, that's an interesting thought. Oh, you have this research. Let me see the research you have. This is my idea. What do you think of my idea? And it's a back and forth conversation coming up with the best solution for you. You also want to have a full female hormone blood panel done. You need a baseline. You need to see where things are. Don't just let them tell you, oh, it's normal. No, nobody is normal. Normal is a setting on the dishwasher or the dryer. It's not a person. And so you want to know what your actual numbers are. How high is your estrogen? How low is your progesterone? Do you need to supplement for both? Because some people do. And so you need to know what those numbers are. Don't just let them say, oh, you're fine. Then do some research on your own. Find out how supplementing with natural progesterone can benefit you. Because I tell you, it is life-changing. It affects not just your cycle, it affects your mental health, it affects your cardiac health, and so much more. And so I encourage you to make sure that you get that blood work done. And then talk with your doctor about it. And if they're not really on the same page as you, find a new one. And when you get that hormone panel done, ask for the C-reactive protein test. It's called cardio-reactive protein. That's the one that was the big scary one for me. Mine was all the way up to 11. Should have been less than 3. I've gotten it down now to about 5. Which is pretty amazing considering where I was. That is a marker that shows you your risk for a future cardiac event. So when you partner that with high cortisol levels, the high cortisol puts you at an even greater risk. And so that's a really nasty combination. And so you want to know where you are with those things. Because for women, heart disease is one of the #1 killers. It far surpasses cancer. And you want to know so you can prevent anything serious from happening to you. And the first step of that is knowing where you are and then coming up with a good solution, a good path forward. No more, do better. And then really research how using natural products can help you get to where you want to be. It's amazing. We have this thing called the wild yam, and it's not like a sweet potato, it's a different plant. But the wild yam will produce a progesterone, we call it the progesterone, that is so identical to our own P4, is what our progesterone is called, that our body recognizes it as the same. and it uses it the same. And so we have been given this amazing plant that will go into our body and do amazing things. And so we just have to learn how to utilize that the best so that we can have optimal health. So I hope this has helped you to understand endometriosis a little bit better and has helped you to understand natural hormones a little bit better. Don't let anybody tell you that there's no hope, because 12 years ago, I was facing a hysterectomy, and I simply said no, and I refused to let that be the solution. And when I was 17, I was told I wouldn't have any kids of my own, yet here I am with 2 of my own children. And so I encourage you, don't give up hope. Keep pushing for answers and be your best advocate, because nobody knows your body like you know your body. And when you go to the doctor, give them the whole big picture. When they ask how your cycle is, tell them. Don't just say, it's fine, it's okay. Give them the details, because like me, you may not know that what you're experiencing is not normal. It's not appropriate, that it shouldn't be what you're experiencing, that it's not healthy. And so give that information to your doctor. Find a doctor that can be your ally, that you can really come together and form a partnership for your best interest. But don't give up hope. So I hope my story has helped you in some way. If you have any questions, let me know. But go do some research on natural hormones and see how that can benefit you. And if you're interested, check out Dr. Dan Purser. You can find his website. It's danpursermd.com, I believe. His last name is Purser. I don't get a thing for recommending his stuff, but I think he saved my life. And that it's kind of hard to not share that with people, because the information that he has was so very helpful. So he has several books out, he's got a website, he's got videos, he's got all kinds of resources, and he even does those one-on-one phone consults where he'll go over your blood work with you and help you understand and give you some recommendations of what he thinks you should do. So do more, right? Do the research, know more, do better. You can do this. Bye.